Hey everyone, welcome to Simplilearn's YouTube channel. In this tutorial, we will learn about healthcare analytics. Healthcare analytics involves the use of data, statistical models, AI-driven insights to improve patient care, operational efficiency, and decision-making in healthcare industry. It is used by hospitals, insurance companies, pharmaceutical firms, public healthcare organizations, and policymakers to track trends, optimize treatments, and reduce costs. Professionals in this field analyze electronic health records, or also known as EHRS, medical imaging, and patient demographics to enhance healthcare outcomes. Career opportunities include roles such as healthcare data analyst, clinical data scientist, healthcare informatics specialist, and population health analyst. With the rise of AI and big data, demand for skilled healthcare analysts is growing rapidly. Strong skills in SQL, Python, Power BI, and machine learning are valuable for success in this domain. This field plays a crucial role in predictive analytics, fraud detection, and personalized medicine, and a lot more. That said, if these are the type of videos you'd like to watch, then hit that like and subscribe buttons and the bell icon to get notified. Just for a quick info, if you want to upskill yourself, master data science and data analytics skills, and land your dream job, or grow in your career, then you must explore Simplilearn's cohort of various data science and data analytics programs. Simplilearn offers certification and postgraduate programs in collaboration with some of the world's leading universities like Caltech, Purdue, IIT Kanpur, and many more. Through our courses, you will gain knowledge and work-ready expertise in skills like advanced Excel, Python, machine learning, data visualization, generative AI, and over a dozen others. That's not all. You also get the opportunity to work on multiple projects and learn from industry experts working in top-tier data and product companies, and also academicians from top universities. After completing these courses, thousands of learners have transitioned into a data science or data analytics role as a fresher or moved on to a higher paying job and profile. If you are passionate about making your career in this field, then make sure to check out the link in the pinned comment and description box below to find a data science and data analytics program that fits your experience and areas of interest. Now, without further delay, let's get started with the topic for today's session, which is about healthcare analytics. So the agenda that we will be dealing with today is, firstly, we will begin with understanding what exactly is healthcare analytics. Then we will understand the role of a healthcare analyst, and followed by that, we will learn what type of companies they work with. Next, we will also learn what are the important skills that you need to have to become a healthcare analyst. And lastly, we will close the session with a hands-on demonstration on how exactly healthcare analytics is being performed. Now, I hope I made myself clear with the agenda. Let's begin with the first point of today's session, that is, what is healthcare analytics? So, healthcare analytics can be defined as follows. Healthcare analytics is a systematic use of data analysis techniques to derive valuable insights from healthcare data, ultimately aiming to optimize patient outcomes, streamline operations, and manage costs and improve overall healthcare quality. So, reading between the lines, there is a slight similarity between an actual data analyst as well as healthcare data analytics. Only the thing that changes is the source of the data. The source of the data for healthcare analytics is hospitals, pharmaceutical companies, and every other company or organization which deals and focuses on healthcare. Now, let's move to the next topic, which is about the healthcare data analyst. So, who is a healthcare analyst and what exactly he does? A healthcare analyst basically collects, analyzes, and manages medical information to identify areas for improvement in healthcare facilities and operational efficiency, ultimately aiming to improve patient care and reduce the costs. Now, there are quite important steps that every healthcare analyst follows, which are completely similar to a regular data analyst, which is about data collection, data modeling, and data management, data analysis, reporting and visualization, recommendation or insights for improvement, collaborating between the business teams, and also predictive analytics. Now, let's move to the important focus points of every healthcare analyst. There are three. Improve patient outcomes, which helps in disease prediction, early intervention, and personalized treatments. Optimize hospital operations, reduce wait times, improve resource allocation, and enhance patients' experience. And reduces costs and prevent fraud, which identifies billing errors, prevent insurance frauds, and ensures efficient financial management. Now let's move on to the next part, which is about what are the companies they work with. As discussed before, every organization or a company which works with healthcare data is involved with healthcare analysts. So hospitals, laboratories, insurance agencies, pharmaceutical companies, Each and every one of them hires a data analyst for their specific needs. For example, if you go to a hospital for some health issue, you go there, every one of your blood sample or any other biological sample has been collected to investigate what exactly is wrong with your body. That's where the laboratories come into picture. And based on that, a detailed approach to resolve your health issue is created, which includes medicines or any of the surgeries apart from that. Lastly, your insurance will be claimed and what type of medicines you followed and any other future medicines that you need to be continuing altogether for a lifetime, everything, right? If you closely observe, once you get discharged from a hospital, you get a file which is called as discharge summary, which includes everything. On which day were you admitted into the hospital, for what reason, and what are the tests they ran upon you, and what are your reports, and based on which what is the action that they took upon you. Is it a surgery or a medical treatment to resolve your issue? And lastly, what was the total amount they charged to you, and which was your discharge date, and any of the medications that you need to use for a prolonged duration to cure the disease completely, right? So all of this was done with the help of a data analyst, which is also termed as a healthcare analyst. If you come out of this small picture, you can focus on a much larger picture, the World Health Organization. The World Health Organization manages the entire world's population, entire number of hospitals in the world, which can be segregated into types of diseases. It is diabetes, it is cancer, or any other, right? Every one of the hospitals, every one of the disease, every one of the healthcare problem is being observed very closely. What are the diseases? What is the cause of that particular disease? Is it an organism which can be virus, bacteria, fungus, or anything apart from that? What is the kind of treatment plan made? What are the type of medicines followed? Is it a saline? Is it tablet? Or is it any injection, right? Each and every one of those things are being observed very closely with the World Health Organization. And such kind of accurate information can be put out only if a data analyst is in the business. So the World Health Organization utilizes healthcare analysts to collect, analyze, and interpret global health data, enabling the organizations to monitor health trends, identify health disparities, and inform evidence-based policy and program decisions. The World Health Organization focuses on four important things: what happened, why did it happen, what will happen, what should we do. So in terms of analytics language, it can be deemed as descriptive analytics, diagnostic analytics, predictive analytics, and prescriptive analytics. Firstly, you will analyze past patient records and hospital admissions. Next, you'll identify the reasons behind the readmission rates. Thirdly, you will focus on forecasting disease risks and patient deterioration. And lastly, recommending treatments using AI-based models. Now, shifting our focus to the next part of today's session, which is about the skills you need to become a healthcare analyst. So, the skills that you need to become a healthcare analyst are completely similar to a data analyst. So, firstly, we will have the data processing and machine learning. So, SQL is essential for extracting, cleaning, and managing large healthcare datasets, ensuring data accuracy and integrity. Python, with libraries like Pandas and Scikit-learn, enables advanced data analysis, statistical modeling, and machine learning applications for predictive healthcare insights. Proceeding ahead, we have the next skill, which is about data visualization. Some of the important tools like Tableau, Power BI, ClickView, ClickSense, Excel, etc. Whichever the tool which is capable of managing and manipulating data with data visualization is important in terms of data visualization for healthcare analysts. These data visualization tools transform raw healthcare data into interactive dashboards and reports, making complex insights easily understandable. They help visualize patient trends, hospital performance, and disease outbreaks, aiding in data-driven decision making. Proceeding ahead, we have the next point, which is predictive modeling. AI-powered models analyze historical patient data to predict disease risks, readmission probabilities, and treatment outcomes. Machine learning enhances early diagnosis, automates pattern recognition, and personalizes patient care. This is where machine learning and generative AI come into picture. Proceeding ahead, the next skill is scalable healthcare solutions. So obviously the hospital data, for example, if you're speaking about the bigger picture, which is the World Health Organization, then the data, the size of the data is monumentally big. In such scenarios, you might definitely need a cloud platform to store, manipulate, and extract the information. So cloud platforms provide secure, scalable storage and computing power for handling massive health datasets. They enable real-time analytics, remote patient monitoring, and integration of AI models across healthcare networks. Proceeding ahead, we have automation and enhancements. So, generative AI is everywhere. It is also integrated with healthcare analytics as well. Generative AI automates administrative tasks like medical documentation, chatbot driven patient engagement, and personalized health recommendation. It enhances clinical workflows by summarizing patient records, improving diagnosis accuracy, and accelerating drug discovery. Now that we have a brief understanding of the critical skills that are required by a healthcare analyst, let's focus on a live demonstration of how exactly healthcare analytics is performed with a small use case. So we are on Microsoft Excel right now. We have a relatively small dataset of 10,000 rows of data, which includes the names, age, gender, blood type of the patient. This is a patient dataset, his medical condition, date of admission, which is the doctor that treated him, which hospital, and insurance provider company. And after that, what was the total billing amount, what was the room he was admitted in, and what was the admission time, whether it was elective admission, emergency, or urgent case, and what was the discharge date of the patient. Apart from that, what are the medications that he or she should follow, and what were the test results, if they were inconclusive, if they were normal, abnormal. Based on that, what was the treatment provided, right? So this is a relatively smaller data set with about 10,000 rows of data. So this will be dealt on one of the data visualization platforms like Tableau. So let's open Tableau now. So we are on Tableau desktop. So we will be dealing with Excel dataset. So let's load the dataset. It might take a little bit of time. There you go. And since our dataset is just one simple Excel file, there is no need for data modeling or establish a connection with other dataset, or joining the datasets. So we have just one single file, so there's no need of that. Now here you can see, you can expand this a little and you can close this. And here you can see the name, and make sure that we have already processed the data set, the data type of every column included. In my case, we have name in dimensions and age is a number, which will be a measure, and gender, blood type. So we have both dimensions and measures, which we will have a deeper look once we get into the visualization part. Let's take a brief look on the dataset first. So here we have the medical condition, date of admission, doctor name, hospital, etc. So the same column names that we dealt with. Now proceeding further, we will get ahead with the demonstration part or data visualization part. So here you can see we have both dimensions and measures. So to proceed with data visualization, there might be a couple of changes or including some values or calculated fields into this particular dashboard. So here you can see we have few measures, and the name part, name of the patient, is treated as a dimension, but we need one of the measures for names of patients, right? Let's say you wanted to calculate total number of patients involved or total number of hospitals, etc. And you might need a calculated field here. So just add a calculated. It's really simple. Just create a calculated field and you can name it total patients. And you can go with count D function, which will only select the distinct names, right? Press tab to select, and the calculation is valid. Apply. Similarly, let's create another calculated field for total number of hospitals. Calculation is valid. Okay. And we can also add total number of doctors as well. Yeah, I think that's done. We can not have this calculation here. And take a quick look, and I think everything is fine. Now let's proceed with the use case for this. Now let's say I also want to maintain a blood bank. Let's say some of the patients might need a rare blood type, and if we have something in inventory, then we can right away help them out. Let's say I wanted to find out blood type. So this will be my first visualization. So I'll be using total number of patients as well as blood type, which is a dimension. There you go. Now you can have blood type on color so that we have a different color for each of the blood type, and you can also have total patients in label so that we can have a count of total number of blood types, right? There you go. Now let's proceed with the next storyboard. Let's say I want to find out test results. How many number of patients are normal, abnormal, and inconclusive. So I'll take total patients as well as one of the dimensions which says medical condition test results. So here you can use show me and use a different type of dimension for this. So there you go. We have 3,370 abnormal patients and 3,206 patients history is still inconclusive. That means they might have to perform some advanced test results so that we can identify the root cause of the disease. And now let's go with a histogram which deals about the distribution of patients' age. So we will drag patient age into columns and we will use a histogram to divide them, and you can also provide it as a label. So we have the number of patients in that age group, and you can also add age to color so that we have a different color. So you see the least number of patients in this particular count is 15 to 20. So we have 2,900 patients in 15 to 20. And the highest, even you can try to organize these. So the highest number of patients come from the age between 75 to 80. So here you can see 70 to 85 is the most important age where you can fall critically sick. And apart from that, you can also see an observable growth where the patients come from 55 to 65 age as well. So it's like you kind of have a probability to get sick at this age as well. Now proceeding further, let's see the insurance agencies. So I'll take total number of patients and insurance providers so that we can have how many insurance providers are currently available and how many number of patients have opted a particular insurance agency. This will help in establishing a good connection with a certain insurance agency or insurance provider during the time of claiming an insurance and minimizing the time of claiming. Let's say there is a highest count for a certain insurance provider, and you can have a good connection with them so that if and ever any patient comes with that insurance provider, you can close that claim as early as possible with lower time for processing. If we proceed further, we can also do a gender-based analysis. So total number of patients, and you can have a gender here. Let's proceed with medical condition. So here we can see arthritis, asthma is the highest health concern. Followed by that we have arthritis and cancer. So you can also provide another addition to it as well. So you can also identify the best hospitals for a particular disease. Let's do that as well. It might be a lot bigger, but still let's try to identify that. Yeah, there are about 4,886 hospitals involved in this particular data set. So I think it's okay. We can kind of filter it out based on the category as well. Let's proceed with the admission types. So most of the cases were either emergency or urgent. And we can also have a trend line analysis for the admissions. We'll take a data type. And we can also further enhance it and elaborate it based on year-on-year values. So in 2023, I think this data set is of only 2023. So you can see a trend line which grows, falls, and again, I think there is a far reduction of patients from 2023. So these are a few types of analysis that you can perform based on healthcare dataset. Now let's create a completely new dashboard. Now let's also adjust the size of the canvas. I'll go with 1120 pixel, and height you can choose to reduce or increase based on your requirement. Now you can pull the dataset. My first chart, I'll adjust this. And you can also kind of include cards as well. So let's do that first before creating a dashboard. We'll proceed with a couple of more stories. I'll have total doctors as card, and I'll name it as total doctors, patients, that will be a card as well, total hospitals that we are dealing with, total billing. We can aggregate that as well to sum, so it automatically aggregated that, and this will also be a card, right? And this will be in order of dollars. Now we'll get back to our dashboard and we will have the cards in place. I'll have the total doctors here. I'll close the show me, and we can. So just dragging and dropping all the stories onto the dashboard and making it completely interactive, you can find yourself a fully functional dashboard. Let's say I want to go ahead with a particular age group for a provided blood group for a provided disease. Then I can have a completely fully functional interactive dashboard which shows me the problem they face, how is it resolved, and what are the medications that they are following, right? If you're going with a dedicated type of insurance provider, then you can have all the data related to them as well, and every part of the dashboard is fully interactive. So the total billing amount this particular insurance company provided with, and the total number of males and females which took that particular insurance, and what was the admission trend, patient age distribution, blood type, etc. Right? So this helps in keeping an active and interactive report of all the healthcare data set. And that brings us to the end of this session on healthcare analytics. If you have any queries regarding any of the topics covered in this session, or if you require the resources like the Tableau dashboard, dataset that we used, PowerPoint presentation, or any other questions, then please feel free to let us know in the comment section below, and our team of experts will be happy to assist you at the earliest. Until next time, thank you for watching and stay tuned for more from Simply.
Hi there, if you like this video, subscribe to the Simplilearn YouTube channel and click here to watch similar videos. To nerd up and get certified, click here.